If you ask most people, they would love to look younger, more rejuvenated. And today, Peaks of Health is back to tell us about photofacials. Welcome back, Dr. Tracie Leonhardt and Jaime Applefield. I love a photofacial. I've had one myself. But what I want to hear about are some of your toys, because if you've ever had this done at home before, there is a slight tingling and pain that does come with the procedure, but you have a new way of doing it to where it doesn't hurt.
Well, some of the newer technology you can use has a cooling system built into it, and we have that one. So it cools as it goes, so it doesn't have the pain involved.
Okay, so photofacials. I would assume, Jaime, you do a lot of these at Peaks of Health.
Yes.
Walk us through who is a good candidate for a photofacial.
So really anybody. This can be used more as anti-aging if you want. This can be used for people who have sun damage, who have dark spots, pigmented lesions, vascular lesions, any kind of color to the face. You can really use this or anywhere on the body. Age doesn't really matter.
How long does the treatment take? And it varies from patient to patient, right, as far as how many treatments you can get or should get?
Sure. I mean, if you're actually trying to treat an area that you're trying to get rid of, a pigmented lesion, you may need multiple treatments. But if you're trying to just do this for more preventative or anti-aging purposes, then you could just use one treatment. The more treatments that you get, the more results that the better results that you'll have. And the treatment time kind of depends on where you're treating. So often we use it on the face, but it can really be used anywhere.
Dr. Leonhardt, there are so many different options out there, different treatments for the face to help us look younger and tighten the skin and help improve the appearance of wrinkles. How can you help somebody at home figure out which one is going to be best for them and they're going to get the optimum results?
Well, for a couple of things. We run a lot of seminars and things, so we actually try to educate the public on what is available to them. And the other thing is we also turn around and do courtesy consults initially. So they can come in for a consult, and this way we look at what they want, we look at their skin type, their skin tone, and let them know what would work best for them for what they're looking for.
Well, tell me more about the seminars. When is that happening?
Fourth Thursday of every month we have seminars at the office, and when we run specials every month, they can go to our website to keep up with when the seminars are. So we have them posted there every single month.
Jaime, when you do these photofacials, what type of downtime can people expect, or what you have seen? How do we need to prepare for that?
So there is no downtime. You can drive yourself to the appointment. You have, the procedure. You could drive yourself home. You could go to work. We ask you to kind of avoid direct sun exposure, use lots of sunscreen, cover that face or with the area that we're treating. So other than that, you really don't have any kind of downtime.
What about the results? What have you seen from your patients? And I'm sure that's rewarding too.
It is.
So you get to see the progress that they've made over those treatments.
Absolutely. So kind of what to expect after the treatment. You may have some redness and your skin might be a little bit irritated or sensitive. Kind of following that, we call the skin, it becomes peppered, you get skin peppering, and basically what this laser does, it's an IPL laser, intense pulse light, and it kind of targets underneath that superficial layer, so not this dermal layer, and it targets these pigmented lesions, whatever color they are, and it brings them to the surface. You get peppered, and then they clear.
Yeah, it gets darker at first, and then it comes right off. And that's the best feeling.
Yeah, skin feels so clean afterwards.